I acknowledge that we are meeting today on the traditional lands of the Burra Matagal people. I offer respect to their elders, past and present, and to all traditional custodians of the land. This presentation is about Aboriginal and Torres Strait Islanders' health. It is being prepared and presented by the following group members: Nabina Shrestha, Minnu True, Cynthia Asuman, Kirat Kaur, and Yuchina Kawankawal. This presentation discusses about disparity in health status and life expectancy in rural dwelling Aboriginal and Torres Strait Islanders suffering from diabetes mellitus. Furthermore, the following slides include the relation between culture and Aboriginal and Torres Strait Islanders' health, social determinants of health that further reflect on health status and life expectancy. Lastly, critically analyzing and drawing reflection on your practice as a registered nurse to provide culturally competent and safe care to Aboriginal and Torres Strait Islander people. Diabetes mellitus is a condition that affects the body when the body is not able to maintain healthy glucose levels in the blood, which the body derives energy from, and this leads to long and short-term complications. It can lead to many complications such as stroke, coronary heart diseases, blindness, or kidney failure. The prevalence of diabetes in the Aboriginal and Torres Strait Islander population accounted for 12% in remote areas compared with 7% in urban and regional areas. The graph indicates proportion of people reporting diabetes or high sugar levels as a long-term health condition by Indigenous status and age group. Australia 2012 to 2013. It is clear from the graph that, for instance, in the age group of 45 to 54 years, only 5% of non-Indigenous people suffer from diabetes as compared to 25% in the Indigenous community. Disparity in life expectancy is known as the difference between the average number of years Aboriginal and Torres Strait Islanders live as compared to non-Indigenous people. Life expectancy of Aboriginal and Torres Strait Islanders is 10 to 11 years less than the non-Indigenous Australians. Diabetes has the second highest rate of death in Aboriginal population in 2013. There are many factors affecting the disparity in life expectancy and health status of Aboriginal and Torres Strait Islanders, such as chronic diseases like cardiovascular diseases, kidney failure, dementia, diabetes mellitus, etc. Death from chronic diseases is 2 and 3 times the rate than in non-Indigenous population. Diabetes causes deaths tenfold in Aboriginal and Torres Strait Islanders than in non-Indigenous population. Furthermore, mental health issues, colonization, and history, governmental policies over the period of time, and social determinants of health such as income, infrastructure, education, culture also affect the disparity in life expectancy in Aboriginal and Torres Strait Islanders. Colonization as a context of Aboriginal health. Before European invasion and settlement, Aboriginal Australians enjoyed an active lifestyle that emphasized on their country, relationship, and ecosystems maintenance and sustainability. The current poor Aboriginal and Torres Strait Islanders' health is directly proportional to the history of Australia during colonization by the European invaders. In History of Australia 1788 to 1850 covers the colonial period. In 1788, the first arrival of the invasive British fleet was marked. Dispossession took place between 1770 to 1885 and 1885 to 2007. During this, the expansion of the settlement and exploitation by the non-Indigenous people reduced the Aboriginal access to the country and making them incapable of their social, legal and religious rights. As a result, the Aboriginal population lost the right to their land, limited their access to nutritional resources, leading to malnutrition resulting into poor immune system and decreased power of the body to combat diseases. After dispossession, the era of conflict and violence 1788 to 1928 began. A range of absurd and inhuman strategies were used to exploit the Aboriginal communities, like poisoning the waterholes, poisoned food, rapes of women, along with shooting, stabbing, and forcing large number of Aboriginal people, including children, to jump to their deaths. The next era was protectionism, 1838 to 1970s. During this era, the invaders gained total control over the Aboriginal people, including marriage, employment, education, and nutrition. 1841 to 1980s marked the Stolen Generation. The Aboriginal and Torres Strait Islanders were injured by stealing their coming generation, that is, their children. Aboriginal children were removed from their family to make them highly educated and highly civilized. The Protection Act 1909 gave the complete right to take custody of any child of the Aboriginal and Torres Strait Islanders people. This resulted into deaths of Aboriginal children in care due to nutritional deficiency, neglection of psychological and physical needs, leading to deaths of hundreds of Aboriginal children in the care system. The survivors of this so-called care indulged themselves with alcohol, harmed themselves trying to suicide, and were further incarcerated. During 1937 to 1969, assimilation took place. In this era, the Aboriginals were expected to behave like non-Indigenous people by incorporating their culture, values, beliefs, and religion. In short, the indigenous people were forced to neglect or forget the true essence of their culture, of what they were. During self-determination (1972 to 1996), the first national inquiry with Indigenous affairs was held, targeting Aboriginal health in 1979. The low standards of environmental and housing conditions, socioeconomic factors, and inappropriate health services was revealed in this era. Whole of this has left an emotional, physical, mental, and psychological scar on the hearts and mind of the Aboriginal and Torres Strait Islanders over these years, and it seems that they are still under the spell of the heart-wrenching history of Australia, leading them being vulnerable to poor health and leading to poor economical, emotional, social status and overall decline of state of well-being. The present status of the health of Australian Indigenous people is directly linked to the history of harmful policies of Australia. Over the period and subsequent policies swinging into action, yet the system has failed to improve the health status of Aboriginal and Torres Strait Islanders, the evidence being the surge morbidity rate due to chronic diseases such as diabetes mellitus, mental health issues, and fourth world diseases such as otitis media, rheumatic fever, tuberculosis. Despite being preventable, these diseases are still prevalent due to the social, political, and medical ineffectiveness. Closing the Gap is a governmental initiative by peak Indigenous and non-Indigenous health organizations and human rights organizations with the main agenda of achieving health and life equality for Aboriginal and Torres Strait Islanders in 2006. The goals of this campaign are to close the health and life expectancy gap or indifference between Aboriginal and Torres Strait Islanders and non-Indigenous Australians within a generation. This campaign has been viewed successful by the year 2030. It is a 25-year program. On the contrary, in the 10-year review of Close the Gap campaign, Australian Institute of Health and Welfare 2007 elicited the fact that beside closing the gap is actually widening in terms of life expectancy and mortality rate. This is due to the mass population of non-Indigenous people on the community lands. Cultural respect plays a vital role to provide better health outcome to people of all backgrounds, especially Aboriginal and Torres Strait Islander people. Study shows that Aboriginal and Torres Strait Islander Australians are unwilling to access healthcare facilities because of poor communication, discrimination, lack of trust, and misunderstanding. Aboriginal and Torres Strait Islander patients often choose healthcare facilities which have good relationship with them or understanding of their culture. The relation between culture and health of Aboriginal and Torres Strait Islanders is of vast importance to understand. These cultural factors affecting the Aboriginal and Torres Strait Islanders' health are: firstly, personal choice. Some of the people believe that looking after themselves was better than going to the healthcare system. Some of them believe that it's not the job of healthcare workers to look after them and that it's an individual responsibility. Secondly, traditional medicine. The Aboriginals and Torres Strait Islanders have always believed and trusted in traditional medicines which was practiced from the previous generations. They used branches of trees and leaves. They would cut them and boil them to drink. Some of them applied these leaves on open wounds to cure them. They also visited traditional healers which most of them believe in and trust. Thirdly, foreign healthcare workers. There are a high number of foreign workers in the Aboriginal and Torres Strait Islanders healthcare system. The presence of more of indigenous workers will help them feel welcomed. Some of them felt foreign workers looked at them differently and that discourages them from opening up. And lastly, trust for foreigners. Some of the Aboriginal people have no trust for healthcare workers, especially the foreigners, because in the past some of them had encountered racism and discriminatory behavior. They feel the occurrences from the past were hard to forget. The World Health Organization defines social determinants of health as the conditions in which people are born, grow, work, live, age, and the wider set of forces and systems shaping the conditions of daily life. The social determinants that impact on the health of Aboriginal and Torres Strait Islanders living with diabetes mellitus are: firstly, physical environment, which includes transportation, healthy foods, infrastructure, etc. When there are barriers in accessing these, it has a great impact on their health. Healthy eating habits is one of the most important cure for people with diabetes, but indigenous people do not have access to healthy foods. It may be outlined by numerous factors like transportation, low financial status, poor knowledge about categorizing good food and bad food for their health. Limitation of transportation in remote areas hinders the accessibility of healthcare because people living with diabetes have to travel long distances to seek healthcare. So, in order to avoid traveling long distances, indigenous people tend to avoid visiting healthcare facilities. Secondly, income or socio-economic status. It has a vast effect on the indigenous health. Low-level family income and education affects the health of the Aboriginal and Torres Strait Islander people. Parents of people living with diabetes lack skills and knowledge to provide for their children. High prevalence of diabetes is linked with low socioeconomic status and hence receiving less effective treatment. Lastly, and most important social determinant of health is education. Aboriginal and Torres Strait Islanders' level of education is low and do not participate in health education including healthy eating. Individuals with a higher educational background tend to avoid obesity, the killer of diabetes. This understanding ensures that they take the appropriate preventive measures, some of which include healthy eating, engaging in physical activity regularly amongst others to avoid obesity, and hence avoiding diabetes mellitus. The roles and responsibilities of nurses to address the disparity in health status and life expectancy for Aboriginal and Torres Strait Islanders individuals who experience diabetes mellitus in remote areas is vital. That further requires a culturally competent and safe nursing and care. Cultural competence has been defined as a set of congruent behaviors, attitudes, and policies that come together in a system, agency, or amongst professionals that enables them to work effectively in cross-cultural situations. According to Nursing and Midwifery Board of Australia, nurses must deliver care which is respectful and culturally safe for Aboriginal and Torres Strait Islander people. Furthermore, nurses must support Aboriginal and Torres Strait Islander people to access to culturally safe and current healthcare facilities. Adding on the community, family, and partnership of Aboriginal and Torres Strait Islander people are the most important factors which nurses must identify to prevent diseases and provide better care for Aboriginal and Torres Strait Islander people. In addition, nurses must be responsible for respectfulness and cultural safety to create a better health system without inequality and racism. It is important to remember that nurses' role in cultural competence starts with the recognition of cultural groups that enable them to get a clear view of the community. At the same time, gives them a chance to respect and acknowledge the view of Indigenous and Torres Strait Islanders population. Culturally competent nurses can minimize the vulnerability of the people to diabetes and its complications by helping them understanding their treatment and assisting them to make healthier choices. Nurses play an important factor to help patients understand diabetes treatment and make healthier lifestyle in the Indigenous community. For example, the Commonwealth Department of Health and Family Service is now Health and Aging funded a project titled The Well Person's Health. Along with the effort of registered nurses, this project introduced a screening program in Indigenous communities in North Queensland, which focused basically on detecting and early intervening cases of diabetes, renal, and cardiovascular diseases. On the other hand, the Indigenous communities were provided with information about the disease, its risk factors, which enabled a community-based primary prevention. Direct referrals to the primary health care providers were made for identified conditions included diabetes. As a conclusion, it would be appropriate to say that the disparity in health status and life expectancy is on much wider scale in rural areas than in urban areas, especially for the people suffering from diabetes mellitus. There are many factors affecting this disparity, such as chronic diseases, colonization depicting how the history and governmental policies have affected the Aboriginal and Torres Strait Islanders over the past decades. Close the Gap was one such policy that was one such initiative by the government to reduce this indifference in terms of health, status and life expectancy, but it failed to stand by its motto. Culture plays an integral part in understanding the health of Aboriginal and Torres Strait Islanders, and health and culture are both interlinked. There are a number of social determinants of health that affect the health of indigenous community, such as education, income, etc. As a nurse, it's the sole purpose of our practice to provide the most safe and culturally competent care to the Aboriginal and Torres Strait Islanders by being aware of their priorities, beliefs, culture, good communication, and being respectful to their culture.